Olá, eu sou Fernando Betete e você está assistindo ao programa Repórter Saúde. Mais uma vez, nós voltamos para os Estados Unidos para uma nova entrevista com o Dr. Stephen Sinatra, médico cardiologista, autor de dezenas de livros sobre cardiologia, medicina integrativa e bem-estar físico, mental e espiritual. Existe um vídeo que já gravamos com o Dr. Sinatra e eu recomendo que você também assista. Nós falamos sobre cardiologia metabólica e aprendemos muito sobre como ter um coração mais saudável. O link está abaixo na descrição. Dr. Sinatra, muito obrigado por abrir um espaço em sua agenda e muito gentilmente passar toda a sua experiência e conhecimento para um público que gosta de saber mais sobre medicina integrativa e principalmente sobre outras formas de tratamentos mais saudáveis e com menos efeitos colaterais. Hoje vamos aprofundar a nossa conversa sobre colesterol. Inclusive o senhor tem um livro que só fala sobre esse tema. Vamos falar sobre um tema que no Brasil é praticamente desconhecido da população de maneira geral e inclusive dos médicos. A palavra é grounding, earthing. E daqui a pouco o Dr. Sinatra vai revelar a importância dessa terapia para a saúde humana. E vamos falar de outros temas que tenho certeza vão ajudar a você e sua família a terem mais saúde. A medicina é uma ciência dinâmica em evolução. Feliz é o paciente que tem um médico humilde e aberto para receber novas informações, mesmo que essas novidades venham através de uma entrevista jornalística. E o nosso objetivo é despertar nas pessoas, tanto leigas quanto profissionais, o desejo de pesquisar, questionar e aprofundar os estudos nos temas que serão falados aqui hoje. Acredite, o que você vai ver aqui hoje, em termos de conhecimento médico, poderá ajudar a você ter muito mais saúde. Ok, Dr. Sinatra. Em primeiro lugar, mais uma vez, muito obrigado. E a primeira pergunta é, o que é colesterol e qual a função dele em nosso organismo?
Well, cholesterol is like a waxy substance in our body. I mean, it's produced by the liver. It comes in certain foods, like eggs, for example. Like an egg yolk has a lot of cholesterol. It's mostly cholesterol, has a little bit of magnesium and other minerals in it. But cholesterol is used by the body and made by the body and taken in a diet, and it does a lot of functions. For example, it can insulate the skin, and when it's found in the skin, it can take the sunlight and actually form vitamin D. Vitamin D is formed by the sunlight hitting the skin, and the cholesterol transforms it into it. So cholesterol is involved in skin dynamics. In the brain, for example, cholesterol is needed for the neurons that talk to one another. In other words, it's a vital constituent of brain health. In fact, a lot of our brains contain what we call DHA, which is the hexacosanoic acid. It's found in squid oil and fish oil as well, but the brain is mostly made of fat. So fat and cholesterols are very important for the body. Remember, cholesterol is a vital component of the GI tract and the liver. It does so many things well, and we have to remember that it's the essence, it's the building block of all of our sex hormones. So cholesterol forms the building blocks or the basic needs of many physiological functions in the body.
Ok, fale um pouco sobre a história da evolução dos números do colesterol, o nível ideal em nosso sangue. Esse número mudou muito nas últimas décadas. O senhor concorda com a mudança desses números? Quanto mais baixo o colesterol, mais saúde a pessoa tem?
Actually, I don't agree with the numbers about lower is better. I mean, there's been some conflicting data in the medical literature, but I can tell you one thing. Let's just take HDL cholesterol, the protective cholesterol. Just recently, for example, and I commented on this in my Facebook page on drsinatra.com. We used to think that the higher the HDL, the better. In other words, HDL numbers of 70, 80, 90, or 100 were beneficial for the heart, especially in women. Now we've realized with newer research that the ideal HDL number is now between 40 and 60 for both men and women. What this means is that we used to think that the higher the number of HDL, the better, but now we've just learned about dysfunctional forms of HDL as well. So when it comes to cholesterol, there's sweet spots in the body. I believe when it's too high, it's not good, or when it's too low, it's not good. I use the HDL as an example. When it comes to LDL, I don't like to see LDLs greater than 180 to 200. I like to see the LDL in the range of about 100 to 140. When we use statin drugs, for example, and drive the LDL numbers down to 50, 60, 70, I don't think this is good for the human body. So cholesterol is an area where too much might not be good for you, too little is not good for you as well. So we need to find a balance and a sweet spot in the cholesterol dynamics.
Ok, na sua opinião, o exame do lipidograma do futuro, colesterol, triglicerídeos, vai continuar existindo?
Oh, okay. If I understand your question correctly, what numbers are we going to be measuring with cholesterol? In other words, there are newer tests for cholesterol. We call it cholesterol fractionization. We used to think if we measured total cholesterol, the HDL, the LDL, and the blood sugar and the triglycerides was enough. This is sort of basic data. What we're doing now is we're fractionating cholesterol. We're dissecting LDL. We know, for example, that small particle LDL can be more invasive, more inflammatory than fluffier particles LDL. And we know the same is true of HDL. So basically, the science on the cholesterol is moving forward. It's getting more complex. There are subtypes of cholesterol that we're looking at. But again, as a heart specialist, I'm not worried about cholesterol. There are greater demons out there when it comes to heart disease. And when it comes to heart disease, I've always felt that sugar is the enemy when it comes to the heart. Cholesterol does so many good things for the body that I just feel that if we kill it or lower it too much, we're getting into harm's way. And we can make the person sicker instead of better.
Dr. Sinatra, por que os médicos ainda supervalorizam os números do colesterol? Quais argumentos o senhor poderia falar para um colega médico para deixar o colesterol de lado baseado na ciência?
Yeah, when it comes to cholesterol, there's a lot of confusion out there. And I myself, as a young heart specialist, was confused. I used to be chief of cardiology at our hospital in my early 40s. And I used to believe in this entire theory of heart disease being related to cholesterol. I used to use cholesterol-lowering drugs. I treated thousands of patients, and I did actually thousands of coronary angiograms. And through my own experience and my own questioning, I realized that cholesterol, it is a risk factor for the heart, but we're barking up the wrong tree. For example, there's a particle of cholesterol, we call it LP little a, lipoprotein little a. It's a very, very small cholesterol particle. It's highly invasive, it's highly inflammatory, and I believe that's the truth about cholesterol when it comes to heart disease. The reason why we don't hear about it is there are no drugs that can treat it. In fact, statin drugs have even been incriminated in increasing this very dangerous risk factor. So cholesterol plays a role in heart disease, but again, I think the total cholesterol, the HDL, LDL scenario, it's oversimplified and it can be very complex when we dissect these numbers out. But the real enemy in cholesterol, in my opinion, is LP little a, this highly inflammatory particle that really, really causes serious destruction.
Ok, Dr. Sinatra, se colesterol não é o nosso inimigo principal da doença cardíaca, na sua opinião, quais seriam os 5 piores inimigos para o coração?
Okay, in my opinion, again, cholesterol creates a small part in the genesis of heart disease. And we talked about LP little a. And by the way, when people have familial inborn errors of metabolism, when they're dealt a bad set of genes, we call it homozygous hypercholesterolemia. That's very dangerous. That's when cholesterol levels get to be 800, 900, or 1,000. Fortunately, I've never seen a case, and these people need a liver transplant to really get well. The heterozygotes, where they have one parent involved, or there's a heterozygote gene where they have cholesterols of 5, 6, 700 or more. These people we have to be cautious of as well. Now, in the United States, about 3% of the population carry this gene. So it is a significant factor. So let's move away from cholesterol. And your question is, what are the other risk factors that are vital for the heart? Well, I wrote the book Heartbreak and Heart Disease when I was chief of cardiology at my institution. Actually, it was my best book. It was in my early 40s. And as you know from my history, I'm not only a heart specialist, but I'm also a psychotherapist. I studied Gestalt and bioenergetic psychotherapy. And by the way, a lot of Brazilians were in the program. I got to tell you, there were more Brazilians in my certification process than there were Americans, and as well as Europeans. But I feel that emotional stress is the cardinal risk factor for the heart. I mean, there's no doubt about it. Look, when women get depressed, for example, if they go through menopause or later on in life, the incidence of coronary artery disease goes way up, about 400%. People during emotional outbursts of anger, for example, have had heart attacks. There are multiple cases on record where loneliness, depression, anger, and even rage is the worst factor, where people have dissected their aortas, had massive heart attacks. So anger, I feel, or emotional stress, or deep sadness, these are the emotional factors that are the Achilles heel for the cardiovascular system. And the reason being is that anger, depression, and these emotional factors, they can turn on hormones in the body. And the hormones can have an adverse effect on the heart. And these hormones are called epinephrine, norepinephrine, adrenaline, and cortisol. And we've heard about these hormones. And basically, the emotional factors of heart disease, I feel, are much stronger than the physical factors, especially cholesterol. Especially cholesterol. When it comes to looking at emotional stress and cholesterol, I'm all in on emotional stress, and I'm less in on cholesterol. Other factors, other than emotional stress, I mean, certainly sugar. To me, is a big factor in heart disease. Dietary factors, LP little a, like I mentioned, is a major risk factor for the heart. Again, that's the real cholesterol story. Then your blood can become more toxic, certainly with what we call homocysteine, C-reactive protein, too much iron in the blood, too much ferritin in the blood. You know, these aspects can cause insidious silent inflammation. But the big three in my mind would be sugar, high sugary diet, and certainly the emotional stress that I talked about, and the LP little a. If I had a patient with lots of stress, high LP little a, and a diabetic at the same time, I would really worry about that patient.
Bom, vamos entrar em um assunto polêmico agora. Afinal de contas, os remédios à base de estatinas fazem bem para a saúde cardiovascular?
In regards to your question about statins, statins can do a lot of good things in the body, and they can do some bad things. I personally feel like they're oversubscribed. I feel they can do some good things for men. In your age group, for example, a male in your early 50s who has a cardiac event, I would prescribe a statin. Now, I actually use statins in men under the age of 75 with proven coronary disease. Why? Do I want to reduce cholesterol? That's what statins do. But the real mechanism, I feel, the way statins are working, it's not in cholesterol dynamics. Statins happen to thin the blood, which is really important in this day and age because you want your blood to be more like red wine as opposed to red ketchup. Red ketchup type blood can stick, can clot. If it clots in the heart, you have a heart attack. If it clots in the brain, you have a stroke. But statins thin the blood. They're remarkable blood thinners in that way. And statins are very, very potent antioxidants. In other words, they can help to prevent inflammation. However, they have a dark side. They can raise the blood sugar. They can render people diabetic. In women, there's an increase in breast cancer in statins. We get neurological effects. People lose their memory, musculoskeletal pains, liver dysfunction. I mean, the side effect profile of statins is serious. That's why I don't use them in the elderly. I don't use them in patients over 75. I rarely use them in children unless if they have those inborn errors of metabolism, like the genetic variants of hypercholesterolemia. If they have that, I would use a statin in a young person. Do I use statins in women? I used to, but then I realized that they were more trouble than they're worth. Women get more side effects than men with statins, and I would only use it in a woman if she had accelerated coronary disease, bypass surgery, stents, angioplasty was getting worse, and I was losing the battle. I would probably use a statin and other alternative therapies that I like to use as well. But my prime population for a statin, to be clear, and I'll say it again, is young men under the age of 75 with proven coronary disease. And remember this, Fernando, whenever I use a statin, I always give coenzyme Q10 at the same time, because statins are incredible cholesterol killers. But remember, coenzyme Q10, which is vital for the heart as well, is involved in the cholesterol pathway. So when anybody gets a statin, CoQ10 levels go down as well as cholesterol levels as well.
Para minimizar os efeitos colaterais das estatinas, quais suplementos são indicados?
All right, whenever I put a person on a statin, I always give coenzyme Q10, because having said before that cholesterol levels will go down and coenzyme Q10 levels will go down as well. In fact, when I was chief of cardiology at my institution in Connecticut, I used to lecture for the drug companies. But then in the early 80s, there was a paper that came out of India that demonstrated that patients taken, it was the early 90s, I believe, I think 1993, came out of India, and the paper stated that patients taking statin drugs, their coenzyme Q10 levels were going down as well. And as chief of cardiology, I said to myself, oh my gosh, I got to relook at statins. So I basically went to the literature, I did all I could, and then one of the major medical journals asked me to look at a paper that a doctor wrote on using statins, and I said I would accept the paper because the paper was correct, but I would also have an editorial written about the downside of statins, particularly about coenzyme Q10, and they suggested that I write the editorial. Now, I said yes on the editorial. Fernando, I spent dozens and dozens of hours going over the literature, reading all I could about side effects of statins, reading about the pharmacology, the biochemistry, and I dove into it, and I realized that statins do have a dark side. They really do. And the darkest side is coenzyme Q10 is the most vital nutrient for the heart. So back then, in my early 40s, as a board-certified chief of cardiology at my institution, lecturing for drug companies, I stopped lecturing for the drug companies because I had to make my own decision, and I realized that coenzyme Q10, being the most significant nutrient for the heart, is being knocked out by statin therapy. So I asked myself the question, how good could it really be? So to answer your question, on anybody taking a statin drug, both a man or a woman, and again, I don't recommend in women, I would use a minimum of 1 to 200 milligrams of coenzyme Q10 as a chaser or as a vitamin chaser when anyone taking a statin. If they were older with more advanced heart disease, I would double the dose, go to 2 to even 400 milligrams of coenzyme Q10.
Ok, Dr. Sinatra, de forma rápida, quais os melhores suplementos para a saúde cardíaca?
In a nutshell, the best supplements for the heart, well, coenzyme Q10, number one. I like omega-3 essential fatty acids. I like squid oil, for example, over fish oil, because squid oil has a lot of, or calamari oil, it has mostly DHA in it. And the one thing important about squid is they only live in the ocean for about 450 days. So I worry about industrial contaminants in the ocean, certainly oil spills, plastics, phthalates, and of course mercury. I mean, any fish that's a large fish, for example, who's swimming in the ocean, I always worry about contamination. Again, not only the petrochemicals, but the heavy metals as well. So that's why I chose calamari, because it's very small, it doesn't live in the ocean a long time. And remember that DHA is very vital for not only the brain and the retina and the eye, but also the heart. Now EPA, which is another fraction of omega-3 in fish oils, remember this, EPA, eicosapentaenoic acid, and DHA, docosapentaenoic acid, these combine to form omega-3. EPA is really good for arthritis, but as a heart specialist like myself, I prefer the DHA. So in a nutshell, coenzyme Q10 and omega-3s. Now, I also like astaxanthin. This is found in salmon. It's the orange color of, it's almost like my tie and a little bit like your tie, for example. This is more red, but like it's the orange color in lobster and shrimp and in salmon. And astaxanthin is a very potent antioxidant. They say it's 50 times more powerful than vitamin C and E and maybe 17 times more powerful than pycnogenol. I take astaxanthin every day myself. I take it in one of the supplements at Healthy Directions. It's called Vitali C, and I take 12 milligrams a day. When I went to Japan and lectured years ago, I learned about it. And then in the last few years, last maybe 10 years, there's been like 1,400 articles in the medical literature on it. So I love astaxanthin. I like the tocotrienols, I like delta-tocotrienol, I like resveratrol, I like turmeric. I mean, you know, the list goes on, but for the big three, again, coenzyme Q10, omega-3, astaxanthin, that would be my top 3 nutraceuticals for the heart.
Dr. Sinatra, o que o diabetes pode fazer com o coração e com as carótidas a curto, médio e longo prazo?
Fernando, this is an excellent question. Diabetes is epidemic in the United States right now. We have about 100 million people in the USA with prediabetes, insulin-resistant diabetes, and overt diabetes. And I think in my last interview with you, I mentioned that one of the reasons why I became a doctor was I grew up with diabetes in my family. When I was 9 years old, 10, 12 years old, I remember my mother being in insulin shock and diabetic shock, and I had to administer insulin, give her sugar. So at a very early age, I realized the perils of diabetes. So it's a problem. It's a big problem in America today. That's why I like a higher fat diet. I like a lower carbohydrate diet. I like a higher protein diet. But diabetes is a problem. Remember, diabetes causes inflammation. And it's the insulin surges up and down that can happen in a diabetic where you get inflammation of the blood vessels. And the average diabetic, they used to teach us in medical school years ago, lives unfortunately less than their normal counterpart. So with diabetes occurring more and more in the USA, we need to do something as in the medical profession, or certainly as a population, and take more responsibility, because this is one illness that has so many complications. Remember, diabetics get more heart disease, they get more retinopathy, more blindness, they get more cerebral vascular accidents. You know, diabetes is a serious disease. Even though we can control it with insulin, it's extremely serious, and we need to prevent it and be very mindful that this is one illness that I believe we can do something about.
Dr. Sinatra, a hipertensão é uma doença silenciosa. Como surge essa doença? A medicina convencional receita remédios para uso contínuo. O senhor concorda? Qual a forma que o senhor costuma adotar para tratar a hipertensão? Hipertensão tem cura?
I have to tell you, Fernando, your questions are very good. You studied hard. Okay, now you're getting into the area of hypertension. Now, hypertension is the major risk factor in heart disease. In fact, in women, it's other than cigarette smoking, which is the worst, hypertension is a major problem, more in women than men. And the reason being is that a woman's heart has smaller blood vessels around it than a male's heart. Actually, a woman's heart is smaller than a male's. I believe we talked about this in our last interview. And the reason why hypertension is more threatening in a female is that because of the architecture of the heart, high blood pressure can cause the heart to be more fatigued when it's filling with blood. And if the heart struggles when it's filling with blood, we call that diastolic dysfunction. That's what cardiologists call that. And this is a problem for more women than men. But women can develop fatigue and shortness of breath as a early symptom. But this problem of diastolic dysfunction can lead to congestive heart failure, which is a serious condition of the heart. So high blood pressure is a serious risk factor for both men and women. I mean, there's no doubt about it. It's something that we have to be very mindful about. It's something that the pressure tends to get higher as we get older. And remember, the American Heart Association, as well as the American College of Cardiology, they've lowered the numbers in the United States for high blood pressure. We used to think, well, if your pressure was 138 systolic or less than 88 diastolic, that was borderline high blood pressure. That's what I was taught in medical school. That's been thrown out the window. Now, if your blood pressure is higher than 128 and higher than 82, for example, these are low numbers, like a lot of us may not even have in this room, this is borderline hypertension. So because hypertension is such a serious risk factor for both men and women, the blood pressure numbers have been lower. Now, some of my colleagues may say, well, that was influenced by the pharmaceutical industry, because the pharmaceutical industry wants to prescribe more drugs. They want doctors to use more drugs. And, this could be maybe not the full truth. I mean, I don't know. But I do know this. When it comes to high blood pressure, I like to use natural remedies first before I use drugs. Now, look, if I have somebody with a blood pressure of, let's say, 170 over 100, and I can't get the numbers down using alternative therapies, I'm going to use pharmaceutical drugs. I mean, of course I'm going to use pharmaceutical drugs, because the most feared complication of high blood pressure is not only stroke, but heart attack as well in both men and women. So if I can't get the numbers down with nutraceutical therapies or less salt in the diet, or certainly weight loss. Weight loss is one of the best ways of reducing numbers. If I can't get the numbers down, I will resort to pharmaceutical drugs. Now, my favorite supplements for lowering the numbers on blood pressure, certainly I like omega-3s. I like coenzyme Q10. I like L-arginine. It's an amino acid that I can give to people at night, which is broken down to nitric oxide, and that has a nice effect in some people. I love hawthorn berry. Hawthorn berry and garlic. These are two herbs that when they're broken down in the body, it can have a blood pressure lowering effect. We call it an ACE effect, an ACE inhibiting effect. And it's very similar to some of the drugs we use in lowering blood pressure. We call these ACE inhibitors. So when it comes to lowering blood pressure, there's a lot of things I like to do. Certainly reduce emotional stress, reduce weight, do some exercise, do some more walking, eat less salt, take targeted nutraceutical supplements, and a lot of these numbers come down. And my last intervention for blood pressure is this, earthing. Well, I didn't do the study myself. I helped support the study. One of my colleagues, Dr. Elkin in California, did a study on earthing, where he took patients with mild to moderate hypertension, and some of these patients are on 3 drugs, and he demonstrated that in every single one of these patients, he was able to get the blood pressure numbers down by simply sleeping grounded. So there's something special about earthing or sleeping grounded when it comes to blood pressure. And if you want to get into that mechanism, I'd be happy to discuss it.
Dr. Sinatra, fazer exames nos dias atuais é rotina e todos pensam que é muito simples. O exame de cateterismo é muito comum. O que acontece com o coração de quem passa por um cateterismo? Quais cuidados esse paciente deve ter após fazer esse exame? O que o médico normalmente não sabe ou não falou de cuidados pós-exame para esse paciente? O contraste usado no exame prejudica o metabolismo por quanto tempo?
Okay, so Fernando, your questions about cardiac catheterization are good. Now, fortunately, I've done about 3,000 in my lifetime, and I've been in a cardiac cath lab many times, including in the middle of the night and all hours. Cardiac catheterization, in my opinion, is a safe procedure. I mean, I never lost anybody. It's something that is done on a routine basis, and I believe it gives tremendous amounts of information about the heart, not only about the architecture of the heart, the outline of the blood vessels, but it gives what we call hemodynamic data. In other words, data that looks at pressures inside the heart. And that information is really vital in determining how to treat a person with heart disease. Now, it's important that when people undergo cardiac catheterization that they hydrate themselves after the study. Some of these dyes can have an effect on the kidneys, for example. I'll never forget it, when I used to do the angiograms in people, they would feel very hot in the body, almost like taking a shot of whiskey, some of my patients would tell me. They would feel heat in the body. And I know from previous experience, sometimes the renal graft dye could, in very rare circumstances, could affect the kidneys of a person. So I would say this, to summarize, in my experience, cardiac catheterization is safe. You should hydrate yourself remarkably after the procedure. Drink lots of water. Again, the data is so cutting edge that, especially measuring the pressures in the heart and seeing the outline of the blood vessels, that in patients with far advanced heart disease, cardiac catheterization brings an enormous amount to the table.
Dr. Sinatra, paciente que apresenta estenose de artérias carótidas em mais de 50%, após o uso de vitamina K2 por 1 ano, apresentou redução de 25% dessa estenose. Como funciona esse processo da vitamina K2 em diminuir essa estenose ou limpar as artérias que estão comprometidas? A vitamina K2 funciona?
I love these questions.
Thank you.
About 12 years ago, I met the 2 Dutch researchers who spent decades of their life studying metaquinone 7 or vitamin K2. And I was absolutely mesmerized by their research. It was incredible. They got their PhDs studying this, and one was an MD. And I have to tell you, the moment that I sat at the table and had dinner with them, I started to take vitamin K2 myself. I've been on vitamin K2 for 12 to 14 years. I have to figure out the exact date. But as soon as I heard this data, I started to use it in my patients. And I remember using it in patients with calcification of the coronaries. And I measured the calcification, what we call with the EBCT scan. In other words, a coronary calcification scan, an X-ray that looks at calcium in the heart. And basically, when I was using the metaquinone 7, I saw a reduction, just like your medical colleague did, in the amount of calcium in the blood vessel. To me, this is natural and remarkable. Whenever you can reduce calcium in a blood vessel, you are getting into the realm of the best preventive medicine going, because once you reduce calcium in the blood vessel, you can help to reduce obstruction as well as plaque rupture. So this is vital. absolutely vital. And vitamin K2, to me, what it does is it literally takes out, through its mechanisms, through the glycoproteins, it takes calcium out of blood vessels where it doesn't belong, and it puts it back in bones where it does belong. So in women who are battling osteoporosis, for example, or aging women who have calcium in their blood vessels, I think vitamin K2 can not only help heal obstructions or reduce obstructions, calcium obstructions of blood vessels, but also put more calcium back in the bones where it belongs. So I am all in on vitamin K2. I know the researchers, I read their research, and I just feel that methaquinone 7, not methaquinone 4, methaquinone 7 is much more bioavailable, much more potent in the human body, but MK7 to me is a vital nutrient for the heart, and like I said before, I take it every day.
Dr. Sinatra, quais os principais benefícios clínicos concretos com o uso do resveratrol? Sabemos que o mesmo é um poderoso antioxidante, mas existe algum sinal clínico que possamos perceber em uma pessoa que começa a fazer uso do resveratrol? Qual a melhor forma de tomar e qual seria a dose?
Another great question, Fernando. Resveratrol, I absolutely love it. I've been using it for over 10 years. This is another supplement I take myself. There is a mountain of research on resveratrol, whether it's the fruit fly, the earthworm, the mouse model. Resveratrol does incredible stuff. Now, in a human model, it's been shown to affect what we call endothelial function, the inner lining of the blood vessels of the heart. And this is one supplement I take myself. I actually combine resveratrol with coenzyme Q10 and omega-3s in one of my supplements at Healthy Directions. But when I learned about resveratrol and how important it is in cardiology, I realized that this is one supplement that I would want to take, and that's why I put it in my program in Healthy Directions. Now, there was a recent article on resveratrol in the cardiovascular literature. I think it was a study of about 60 patients, but it showed remarkable improvements in the heart in patients who were compromised with heart disease. So resveratrol does a lot of good things for the heart. And again, there's some anti-aging data on resveratrol. One of the researchers on resveratrol, he was cited for some inappropriate comments that he couldn't back up, but that was the only negative that I seen on resveratrol, in my history of looking at the supplement. But again, this is one supplement that I wouldn't hesitate to take on a daily basis. And you don't have to take a lot of it. 10 to 30 milligrams of resveratrol goes a long way. So for your people in Brazil, if they see data on 200 or 250 milligrams, I think that's too much. I think this is one supplement where less is more. Remember, it's found in red wine. But again, to get like 30 milligrams in red wine, you'd probably have to drink maybe 100 bottles of it. So, but anyway, this is one supplement that I would like not only my colleagues, but also my patients to take as well.
Bom, a gente vai mudar agora um pouco o foco da nossa entrevista com o Dr. Stephen Sinatra. Já estamos indo aqui para a nossa reta final. E a próxima pergunta é o seguinte. Hoje é cada vez maior o número de pessoas com doenças mentais, tipo ansiedade, síndrome do pânico. Explique o que acontece no corpo de uma pessoa, quais sintomas ela apresenta para podermos identificar e diferenciar cada uma delas. E gostaria de saber como ela afeta o coração. Como um cardiologista pode diferenciar um ataque cardíaco de um ataque de pânico?
First of all, it's very difficult to distinguish a heart attack from a panic attack. When I was a young doctor and I would see people in the emergency room in panic with chest pain, some of those patients did have a heart attack, and some of them did not. In other words, it was a panic attack. But when people get a sensation in the chest, whether it's esophageal spasm, where the esophagus is in spasm, but it could look like a heart attack, or if they have an ulcer, or if they have, let's say, a pulled muscle in the chest, Sometimes this can elicit panic in a person because it's in the chest. And remember, sudden death occurs frequently in the population. In fact, 40% of all cases of heart disease end up with sudden death. So as a heart specialist, if I had a patient with a panic attack, I took it very seriously, very, very seriously. And again, sometimes it's indistinguishable, but panic is a serious problem. And speaking like a psychotherapist now, I would tell you that panic is a reflection of severe anxiety in a person. And anxiety is one level, and most of us have anxiety at one point, but panic is on a different level. Panic is when the anxiety can get out of control, so to speak. And when you have uncontrolled panic in a person, that can be dangerous. I believe people have committed suicide under panic situations where the fear is so overwhelming that they make a mistake and they miscalculate and stuff like that. So I worry about panic. And again, if it's present in a person, I would use pharmaceutical drugs to try to bring the panic down to at least an anxiety level and try to bring that down, because these are different stages where you do not want to get loss of control, because loss of control can be a major factor in one's health.
Dr. Sinatra, o equilíbrio mente, corpo e espírito é fundamental. O que o earthing pode fazer pela nossa saúde, que é o próximo tema relacionado a esse livro?
The topic of earthing, I love earthing. And, as a heart specialist, I've always believed that the reason why people get heart disease is they get out of balance between body, mind, emotion, and spirit. So you must bring these domains into the healing process. Spiritual healers have told me, for example, that when the person gets off a spiritual path, that many times angels may create an illness in a person to get them back on a path. In other words, sometimes an illness in a person can be a reflection that they're out of balance between body, mind, and spirit. Now, let's just talk to earthing, for example. What does earthing do? Earthing actually attenuates the autonomic nervous system. In other words, we just spoke about panic and anxiety. Well, one of the best ways of attenuating what we call autonomic hyperactivity, or the autonomic nervous system, is to put your bare feet on Mother Earth. When you put your bare feet on the earth, what happens is you absorb electrons. And these electrons get absorbed through the feet of your body. There's an acupuncture point called the K1. And this acupuncture point goes up through the spine, around the pineal gland, into the brain. But the bare feet on the ground drives these electrons into the body. It's like taking handfuls of antioxidants. And earthing not only will thin the blood, regulate the autonomic nervous system, can down-regulate or support heart rate variability. It can, bring down cortisol, bring down adrenaline. Earthing does everything right for the heart. And in fact, we've even shown that little study where it lowers blood pressure as well. So when it comes to earthing, there's no downside to earthing. The only caution I have is on people who are taking Coumadin-like drugs, blood thinners, not aspirin, but I'm talking about more potent blood thinners that make the blood thin. We know that earthing thins the blood. So my only caveat, or my only contraindication to earthing, is on people taking powerful blood thinners, because we know that earthing in itself thins the blood. We don't want to thin the blood too much.
Existe comprovação da ciência para a prática do earthing?
Oh my gosh, there's lots of scientific evidence. I mean, I published 2 of the articles myself. There's about 24 articles in the medical literature. Some of them come out of universities, like I believe the University of Pennsylvania on neonates. That came out recently. They were using this as a way of healing the small babies, the premature babies, so to speak. But there's a mountain of research on it. I think the generation that follows me will do more research on earthing and grounding. Remember, earthing has its origins going back not centuries, but I would say, maybe 100 or 200 years with the American Indian and walking barefoot, and even in Europe. So, even with, caveman and stuff like that. I mean, earthing does so many things right. But now, recently, in the 21st century, we've done the science to show that there is really scientific documentation about earthing. And this is something that I do every day myself, by the way. I sleep grounded on grounded sheets every single day. And even when I go to hotels, when I lecture, I bring sheets with me. And when I work on a computer, for example, I have a grounded pad at my feet. So I want to be grounded. And by the way, the computers that I work on, I don't use Wi-Fi. I use internet computers, or what we call wired computers, into the wired ground of the home, because you want all these electrical devices to be grounded. If they're not grounded, that means that you're in a sea of what we call electromagnetic soup. So I'm very cautious about Wi-Fi and things like that can cause inflammation in the body. And remember, grounding, I call it vitamin G. It's a great anti-inflammatory.
Dr. Sinatra, como devemos praticar o earthing? Hoje moramos em cidades e temos concretos por todo lado. Tem jeito de ter contato com a natureza?
Is there a way you can get back to nature, especially if you live in a city? This is an excellent question. And basically, what I tell my patients, my colleagues who live in the cities, it's difficult to walk barefoot in the cities. Especially since if you're working on asphalt, for example, you won't be grounded. If you're walking on brick or stone or concrete, you will be grounded. I mean, the best place to ground yourselves would be grass. Certainly if you have a concrete floor in the house of your home, that would be grounded. If you have a tile floor and there's no wood beneath the tile, if the builder puts concrete and then tile, that's an excellent way to be grounded. I know in my house here in Tampa, one of our floors is like that, and I walk barefoot in the house all the time. So it's important to realize that if you can get away and go to the beach, which is the best way of grounding yourself in the surf of the water, because the water contains a lot of sodium and a lot of minerals, which enhances the grounding process. Swimming is a great way of grounding. But walking in parks barefoot, try to use your home. If you have some grass at your home, if you have a backyard and you're not living in a city, for example, that's a great way. If you do live in a city, it's harder to ground. It is harder to ground, but people that live in cities, I still see them walking barefoot in parks. In fact, I was in New York City only a couple of weeks ago, and I was in the Central Park area, and the first thing I did was take off my shoes and walk barefoot. So there are multiple parks even in New York City, there's like 7 or 8 parks. And one day I walked 6 miles and I walked through all the parks because I wanted to walk grounded. And remember the other thing, it's very important. If you have leather shoes, leather, not rubber, but the leather shoes, I'll show you this. Maybe I can do this for the camera. But for example, my shoes are leather. This is thin Italian leather. And I'm sure Sonia walks on leather. But women, if they walk on thin leather shoes, that conducts the grounding energy of the earth. So you're taking in Mother Earth if you're walking on leather. So this is a big plus for leather shoes. The problem is that all our kids and adults, they're working on sneakers, they're working on tennis shoes, or walking on these rubber shoes that insulate you from the energy of Mother Earth. Once you're insulated, you're not taking in the grounded energy.
Ok, vamos para as duas últimas perguntas aqui com o Dr. Sinatra. Qual é a sua mensagem, Dr. Sinatra, para aqueles profissionais de saúde que ainda não ficaram a par da importância do entendimento do papel da alimentação e suplementação adequadas no restabelecimento e manutenção da saúde?
The problem la problema with health professionals and doctors is that many of them are trained in the pharmaceutical model. And unfortunately, that's the way it is. That's the way it was when I went to medical school and when I was a young intern and a resident and a fellow in cardiology. Everything was pharmaceutical drugs, and doctors aren't trained in nutrition. Even in the USA today, unless if you take outside courses, for example. But when it comes to healing the body as a physician, nutritional healing is really, to me, the most important. Because, even this morning I was answering a reporter about glycophosphates, for example, Roundup, that's in our food supply. Now, if you're eating foods that are contaminated with Roundup or fertilizers or toxins, this is not good as well. So in other words, when it comes to the food supply, the purest food is really what we want to go with. Organic foods, for example. And if you can't go with organic, you must choose foods that aren't heavily sprayed. For example, in the United States, the 3 most sprayed fruits are apples, peaches, and strawberries. So if I go to a farmer's market and those fruits are, let's say, sprayed, I'll avoid them. Will I eat them if they're organic? Yes, I would. So we have to be cognizant of the food supply. Unfortunately, doctors are not trained, in nutrition. I know myself, I'm a member of the American College of Nutrition. I took the certification examination. I studied, I studied like crazy for it. I read a stack of books this big. I studied for months. I took the exam and I became a certified nutrition specialist. So doctors can take specialized examinations. They can read books. There's a lot out there on nutrition. I mean, for me, nutrition was the backbone of how I treated patients. And I believe it's the most important thing in treating the patient. And again, some patients need pharmaceutical drugs, but I rely on nutrition even more.
Vamos então para a nossa última pergunta aqui para o Dr. Stephen Sinatra. Quais foram os conhecimentos médicos que mais marcaram a sua mudança de paradigma na área da saúde e como isso ocorreu na sua vida?
So you want to ask me the question, why I became a doctor in recovery, so to speak. In other words, here I am as a well-trained cardiologist. I took 4 years of medical school, a year of internship, 2 years of medical residency, and 2 years of cardiology fellowship. And I became very well-trained. And then all of a sudden, I started to veer off in alternative medicine. I think on the last interview, I talked about Jacob Rins. I met this Dutch chemist on a telephone interview. He was 91 years old. I was taking care of a patient that he was taking care of with high blood pressure, and the patient asked me to call him. And I got on the phone. He was 91 years old, and he was speaking like a 16-year-old. And he avoided bypass surgery, and he got into my brain. He got into my head, Fernando. I was mesmerized by the telephone call. And basically, he was talking about phosphatidylserine, phosphatidylcholine, magnesium, lecithin. I didn't even know what these supplements were. And here I was, a full-fledged board-certified cardiologist. So after the telephone call, I asked him how old he was. And when he said he was 91, I said to myself, oh my gosh, if I could make it to 91 and speak like he did, I want to take what he's taken. So at that time, I started to study nutrition. I was only 31 years old. Like I said, I was board certified in cardiology. And I started to question the use of more and more pharmaceutical drugs. As a result of that, I wrote 25 books. And remember this, when you write a book, you're not an expert. You learn a little bit. But every book I wrote, I realized I needed to learn more. So then I had to write another book. And after writing all these books, I realized that the medical profession, it's so complex. It is so complex. And that's why I developed the 6 pillars of healing. In other words, it's not just about a healthy diet and exercise and targeted nutraceuticals. It's mind-body medicine. It's detoxing the body, and it's also earthing and grounding. At least if you can do those 6 things, and bring a healthy diet and targeted nutritional supplements and pray more and maybe do some yoga or tai chi or qigong. All these things work. These all assist in healing the body. The problem with most American doctors and our American medical system is that we rely on pharmaceutical drugs too much. Now in emergencies, an obstetrical emergency, an automobile accident, an acute heart attack, an appendectomy, do we need pharmaceutical drugs? Of course we do. Even if you have a tooth pulled, you may need pharmaceutical drugs. I mean, the problem in our society is we rely too heavily on them. And this is something that I think more and more doctors need to back off on, because pharmaceutical drugs can cause harm as well. I mean, look at aspirin. It's a lifesaver for a lot of people. But 19,000 people a year die of aspirin. Why? Because of GI bleeding. Aspirin can erode the GI tract. And in anybody who has esophagitis or takes a lot of caffeine or drinks a lot of alcohol, aspirin can cause excessive reflux in those situations. So in my course of being a doctor, I've learned a lot. I've had a lot of people placed in my path for a reason, including Tommy Rosa, the last person that was placed in my path, who really got me more on a spiritual path with heart disease. So I have to tell you, I just feel that I'm still in my path. I'm 72 years old, but I'm still learning. I mean, maybe in the next 10 years, if I live that long, I'll learn more and more, and I'll finally get it, what it takes to become a doctor. But I think the more gray hairs I get, the better I am, the better I'll be at treating patients.
Ok, thank you, Dr. Sinatra, pela nossa entrevista.